Hi, I'm Dr. Nick Weddle with Restoration Chiropractic and ScoliosisKC. Today we are doing the Scoliosis Consult. My hope in this is to provide you with some more information about our program in a comprehensive and yet understandable way so that you can make a good decision for you or one of your family members on the type of treatment you want to do for scoliosis. Before we get to the specifics about your specific or your child's specific scoliosis patterns, I want to give you a better understanding of the bigger picture of kind of how we understand scoliosis and how we treat it. The main differences are that scoliosis is not primarily a two-dimensional problem. If you've had any work with an orthopedic doctor or even other chiropractors, oftentimes scoliosis is simply viewed as this abnormal curve when the spine should be straight up and down. So viewed only in 2 dimensions and not 3 dimensions. And that's one of the main problems, is that you can be put into a brace, you can have surgery performed, the fusion surgery, basically just with the information of understanding the size of this Cobb angle of that scoliosis. And that we measure the same thing with that Cobb angle, but it really provides us very little information to the whole bigger picture of that person's spine, their spinal configuration. So primarily, we are viewing the spine 3-dimensionally. So we're not just dealing with the abnormal side curve, which is that scoliosis or what is that Cobb angle on X-ray, but that we are viewing the spine 3-dimensional. So we are taking into account the side curves of the spine. So when you look at the spine from the side, you should have 3 curves. You should have a neck curve, a mid-back curve, and a low back curve. The neck and low back go forward or it kind of in curves, and the back curve, the mid-back curve, goes back. These 3 curves are what physically give our spine the strength and flexibility to be able to withstand gravity and to walk and run and jump and pick up things. And most patients with scoliosis do not have these normal curves from the side. They've got, in all cases, have a loss of the normal neck curve, either with significantly just straight posture where there's hardly any curve, or we have considerable forward head posture where the head drops down forward and that neck is very, very straight. If the scoliosis is in the mid-back or low back, they typically have a flattening or a reverse curve in the mid-back, where the mid-back curve kind of goes inwards. And in the low back, either also very straight or we lose that curve, or sometimes that curve goes hyperlordotic, meaning that curve in the low back is greater. So often gives the patient the presence of a larger low back curve, and often where their butt will stick out more. So in our evaluation of the scoliosis, we are not just treating this abnormal scoliotic curve. That is just one component of the full spine configuration. Remember, it's important to understand that scoliosis is not a skeletal problem. It is not a muscle problem or a ligament problem. Scoliosis is primarily a neurological or a neurohormonal disease that manifests itself in the spine. So we have to recognize it's the coordination of our spine, of the muscles, of the ligaments that hold our body to gravity, but the coordination of that through our brain, which there's a problem. So in the CLEAR program, our goal is not simply to straighten that curve. Because if our only goal was to straighten that scoliotic curve, then fusion surgery, where we insert and fuse metal rods to the spine, that would be the most effective way. The problem is that with that type of surgical approach, yes, you might get a decent amount of reduction in that curve, but the problem is then that spine is permanently changed. It will never ever move again. And so we recognize that when we talk about treating scoliosis or even treating someone with scoliosis, our goal is much bigger than just trying to force this curve straighter. What we're trying to do is both give the patient good flexibility, good spinal control, but then good quality of life. Just because you can take metal rods and force someone's spine straighter does not mean they're still not going to live with pain and dysfunction and functional problems for years and years down the road. Many of you at this point have been through the standard orthopedic route, typically the medical route, which typically looks at bracing and then ultimately to surgery. And that's one of the issues, is that those are pretty much the only 2 options that exist in the majority of people's experience for medical treatment for scoliosis. For bracing, typically in the younger ages, up to about maybe 13, 14, 15 years old, is where they're in that, where they're candidates for that bracing. The difficult part, and this is one thing that I stress, is that bracing is not designed to correct scoliosis. If a patient has a 22 or a 25 degree curve and they are a candidate for bracing, it is not to reduce that 25 degree curve. A successful bracing treatment is designed to prevent that curve from progressing larger. specifically to the surgical threshold, somewhere around that 40 or so degree mark. So theoretically, a patient could start at 25 degrees and go through bracing, and they could reach 39 degrees after, a year and a half or however long, and that could be determined as successful treatment protocol. And so to me, it's insufficient. That's not really a good measurement of a successful treatment. So again, if bracing is not doing a significant job of reducing curvature and improving that, then it really questions, is this a very good or valid treatment that we should be continually using long term? For the surgical fusion, one of the main goals of any treatment is to kind of prevent the need for surgical fusion. And so one of the things that I want to say that I catch a lot of people saying is that they want to do treatment, even within our program, to prevent their curves from getting large enough where they will have to have surgery. So I emphasize that because there's no medical necessity for fusion surgery. And you'll see this in some of the research that I'll present with you, that we talk about it simply that becoming that 39 degrees to 40 degree, or in some different countries and even around the United States, there's different levels of where that surgical threshold exists. But the idea is that just because you might breach 40 degrees, or several patients this week I've seen that are in the 50s and 60s, just because they have large curves does not mean that they have to have surgery. It simply means that they are a candidate for, meaning the orthopedic surgeons will not undergo the procedure with somebody who's got a 35-degree curve. So we want to understand that it is not a requirement, or there's not medical necessity, but that it is simply now an option, or that patient's simply a candidate for. In the CLEAR program, the first thing that we're going to do in determining if a patient is a good candidate for our program is going to be doing a complete new patient exam, including the full CLEAR x-ray series. Unlike the traditional scoliosis x-rays, where it's just this picture A to P of the mid-back or low back to see that abnormal side curve, or two-dimensional, the CLEAR scoliosis series will be going through a three-dimensional x-ray series of the entire spine. Again, we're not just treating that one abnormal curve, we're treating the spine as a whole three-dimensionally. And so, like I said, we're going to be looking at the spine not only in the area where the scoliosis is, but then the neck and the mid-back and low back and all the aspects. In the CLEAR x-ray series, in the cervical spine or in the neck, we're going to be doing a flexion and extension picture of the neck from the side to see the total range of motion and to see especially the ligament laxity in certain areas. An example of this is that in most patients with scoliosis, they respond very well to basic chiropractic adjustments. And that's a good thing. Most feel really good with adjustments. However, several of the basic chiropractic adjustments that are performed due to ligament issues in the neck, especially with patients with scoliosis, those adjustments can be contraindicated. So quick manual thrusting adjustments to areas of the spine where there's hypermobility is not indicated long term. In the cervical x-ray series, we're also going to do an A to P open mouth of the head and neck to get very specific measurements of understanding the placement and the alignment of the spine. Unlike with the scoliosis measurement just for that Cobb angle, that one measurement, we're going to measure the spine in what we call spinal units. So we're going to break the spine down into multiple units so that in every one of these smaller areas, as we're able to adjust specifically and then also to do specific exercises for these angles, as we correct the individual spinal units, then globally the spine is going to get straighter as a whole. In addition to the comprehensive scoliosis x-rays that we're going to do a very comprehensive scoliosis exam, orthopedic tests, balance tests, breathing tests, all of these to give us a bigger picture of how this person's body is reacting to their condition with scoliosis, but then how we're reacting to the environment. We're going to do posture pictures to be able to visualize the spine up in front of a grid so that we can see how a patient's body is aligning to gravity, both in the front and back plane as well as from the side to side. Once we complete the full new patient exam for the scoliosis patient, this information will give me the ability to assess whether or not this patient is a good candidate for our program. Now, I say that in reality that most patients are candidates and are good candidates for that. There is no guarantee for any patient specifically of how they're going to do. What I want to do as a doctor is to assess the patient's ability and to see how their spine reacts as we go through the first couple visits and the first couple kind of assessments, so that I can then give you as a patient or you as a family members an understanding of what I expect, of how well I think this patient's going to do. Just like with any treatment for scoliosis, there is no guarantee for results. So just like with surgery, is not a guarantee that you're going to reduce that scoliosis by 50 degrees or however many degrees, or just like with bracing, every patient's going to react differently. Even if we had twin sisters or twin brothers doing the program, they themselves will always react differently and unique to their specific curve pattern and their overall physical ability. An additional assessment tool we will use is what's referred to as a stress x-ray. Once we get the patient doing some of the specific NMR exercises and kind of determining what's the most effective or the best setup that they're going to be using, we'll do stress x-rays where we physically place the patient with the spinal weights on, head weights, scoliosis cantilevers, on in front of the x-ray, and we'll physically take an x-ray while they're wearing this. This will show us how their spine is reacting specifically to that setup so that we can evaluate if this is truly an effective setup for the reduction and stabilization of the scoliosis, and also the increase or the stabilization of the normal curves of the spine from the side plane. Next, we'll do several x-rays of the mid-back and the low back, both in the lateral and the A to P planes, to be able to see how the spine is positioned. In addition to the static films, we'll be doing some lateral bending films. So depending upon the patient's curve or specific curve pattern, we'll be seeing how flexible they are. So a person who has a classic, like a right thoracic curve, or it's a kind of a one, like a C curve, we're going to be doing lateral bending x-rays so that we'll physically see how much flexibility that patient has. That does make a difference in understanding how a patient's going to react. For instance, if we have a patient who has a 40-degree curve, right thoracic curve pattern, and in a lateral bending position that curve goes down to 20 degrees, that shows that we've got about 20 degrees of flexibility. Now if a different patient, same kind of curve pattern, went from 40 degrees down to 35 degrees, we would be able to see there's very little flexibility, and that's going to impact the ability of their body to change doing the exercises and different therapies that we're doing. In addition to the standard clear treatment that we will be performing, some patients may have the ability to use a new type of brace called the Scoli brace. Standard hospital or orthopedic bracing has traditionally been looked down upon within the clear program simply due to the ineffectiveness of the type of treatment. That said, one of the new types of bracing, specifically the Scoli brace, is what's called a hypercorrective brace. So although I recognize that bracing in general, wearing a brace for many hours a day, is not a very popular treatment option, the Scoli brace, what we're seeing is having some very successful results even in patients that are older and even into adulthood. So typically teenagers, once they reach about 15, 16 years old, they've gone through the majority of the growth spurt, they're typically no longer candidates for bracing at that point. So there's a kind of a small window for traditional hospital bracing. In a hypercorrective brace like this, we're seeing patients well outside of that range still getting correction and getting good help. So in some cases, and we'll talk about this with each specific patient, that Scoli brace might be a good option for that patient to use or to wear, in addition to the standard clear program that we'll be doing here in the office. One of my main goals in all the care that I provide is really talking about informed consent. My job as a doctor is not to be able to convince you to come into my clinic and do care. My job should be to determine what is the most appropriate and most effective care for each individual patient. So within that, I recognize that the program we do, again, I'm biased, but again, I'm biased because I feel like it's the best option. So again, we'll often talk about other options patients have. We have one other new therapist in the Kansas City area that's doing Schroth. Schroth is an exercise program that is popular in the UK and around Europe, and so there are different options, and I want my patients to understand those, and we can kind of talk to the specifics of how they differ or what are the advantages or kind of pros and cons for those. But again, my goal is to provide you with the information so that you can become an expert in understanding, either for your own body or for your kids, what options you have and what treatments you can do. One of the things that I really like about the CLEAR program, besides that it's three-dimensional versus a two-dimensional treatment approach, is the type of exercise that we do. The CLEAR program utilizes both physical, like isometric exercises, as well as isotonic exercises, but the balance training, or what we call NMR, neuromuscular reeducation, is the process of doing an exercise, but that it's unconscious. So while the patient stands on the vestibular disc, or the vestibular air disc, doing kind of a balance exercise, we place spinal weights, kind of strategically placed weights on that person's body, so that while that patient is standing there just watching TV, they're not having to think about anything besides not falling down. We place the weight strategically on their body so that as they stand in balance, unconsciously their body is reacting differently to gravity in a way that it hopefully is correcting or changing the curvature in a way that's beneficial. So whether it's with a patient dealing with the side-to-side curvature with the scoliosis, or if it's in the front to back to increase the neck curve or low back curve or mid back curve, we're placing these weights so that as the patient stands and balances, their brain is having to think and react unconsciously but different than they normally do, hopefully in a way that's increasing and changing those curves for the better. These types of exercises are primarily unconscious, meaning that you don't have to consciously think about them. And that's one of the main differences within the CLEAR program than any other type of exercise program, is that the main exercises we are doing are unconsciously controlled. Any type of exercise that I might go to the gym and do, like bicep curls or bench press, those are what are referred to as isotonic exercises, meaning that when my brain controls my bicep muscle or muscles to move, it contracts and then it pulls those bones through a range of motion. And so that's typical exercise and that's good, but what we recognize is when we're talking about the control of the spine, the primary muscle functions of the spine is not for motion, but to stabilize and hold. So when you imagine somebody leaning over to pick up a heavy box and standing up, they're bending forward and losing the curve in their low back. And again, we've been told most of my life, or most of us have been told, that you don't lift with your low back, you lift with your knees, right? Your legs can do the lifting, your back is to stabilize, to stay in that curved position, and you prevent yourself from injury and more trauma. So most of the motions of the spine, or the muscles of the spine, are designed not to move the spine, but to stabilize and hold the spine while your arms and legs do the moving. These deep, what we call intrinsic muscles of the spine, are not controlled with conscious thought. So most of the core muscles, so we kind of use that core word that's been popular for the last few years, referring to the muscles of our spine that hold us, stabilized. These muscles are primarily intrinsic, meaning that these are unconsciously controlled muscles. So when we talk about things like balance and posture, and these get into some big ones because again, most patients with scoliosis have poor posture or bad posture. And I want to talk about that specifically because in our culture, if somebody has bad posture, or you're at church or at the movies or somewhere and you see somebody slumped down with bad posture, we don't say it out loud because it's rude, but we recognize the first thought often is they're lazy and they need to try harder. And maybe that's from our own family members nagging at us to have good posture or things like that. But we recognize that if someone has bad posture or poor posture, it is not an issue of laziness, it is not an issue of willpower. We recognize that posture, where our body is to gravity, is primarily an unconscious neurological reflex. Right? So hear that. It is not an issue of laziness. It is an unconscious neurological reflex. So that reflex, or that proprioceptive, that postural control, that's kind of messed up. But it's not an issue of that person not trying hard enough. Because again, if Johnny is sitting here all slumped over with bad posture and somebody in his family nags at him to sit up straight, and out of fear or just because he's a good boy and listens, he sits up and has really good posture, right? So to everyone else around him, this looks really good. He's got good posture. But to him, he might be uncomfortable, he might be in pain, he might be fatigued really quickly, and so for maybe 20 seconds he has good posture, but as soon as he either gets tired or that person leaves the room, he's going back to normal. So again, it's not good, but it's normal to his brain and his body. So when we recognize that understanding of posture, whether for the scoliosis patient or a patient that doesn't have scoliosis, a lot of these are the same with regard to the neck curve and the low back posture, is that to change these things, we have to do very specific types of exercises. Most exercises that patients do if they just go to the gym or watch videos, most of them are isotonic, meaning that the contraction of those muscles is done with a range of motion. And again, not saying that that's bad, but it does not have the same effect to the muscles of the spine and to the overall neurological reflex as isometric exercises. Isometric exercises, again, take place without body motion, but that's primarily how, say, the muscles of the spine work, just in you sitting up straight or standing up. So while most of the work takes place in the office, every patient has a responsibility to do exercises every day at home. So this really comes down to the patient, and I don't care if you're 11 years old or 12 years old or you're 35 years old. The reality is that you have to make the choice to do your exercises every day at home. Now, I'm not asking you to do 4 hours a day. What we're typically looking at in most patients are doing 2 20-minute sessions of the balance training or the NMR exercises, in addition to about 5 to 10 minutes of isometric or some other exercises, some warm-ups. For patients that have curves that are larger, more of the moderate to severe, these cases will often require the patient to have the scoliosis traction chair for home use. There will be information in the packet about the purchase of that home chair. We can talk more about that to help you guys understand. There'll be additional information in the packet for those that need to get the chair at home, but that'll be one thing that we'll talk more specifically about if that patient is a candidate or if they really need that. For those that have to use the chair at home, it's typically 2 half-hour sessions, so it's better if we can split these out sometime in the first half of the day versus the second half of the day. So they'll be doing 30 minutes of the chair in the morning, 30 minutes in the afternoon, and then again the 20-minute balance session on each end. So again, we're looking at a little about an hour in the morning and an hour in the afternoon, or afternoon to evening, depending on when the patient can do the time. Probably one of the most important aspects for me assessing a patient if they're a good candidate for this is their willingness to do the exercise, to do the work. No amount of threatening to ground a teenager from mom and dad or someone can be successful to get a patient through the program. Each patient has to really want to do the work, both in the office and at home. One of the realities is that the home therapy is maybe not necessarily more important, but as important as the time the patient spends in the office. So I've had numerous patients who've gone through and they were really great in the office, but when they went home, they were not compliant to doing their exercises daily, and that will immediately affect their success and their spine changing and stabilizing. So I can't stress that enough, that for the patients doing the program, they have to be committed to doing their therapies every day at home. That's really the major factor that's going to make a big difference in their care. One of the unique things about our office is that both of my staff, Marcy and Mary, have scoliosis themselves and have been through the program. So one of the things that I really like about that is that they have a unique perspective on what we're doing that's different from me. Again, I don't have scoliosis, so my hope is that going through this information, that this isn't too much, but enough to really help you to be able to think and ask some good questions. So the first thing I want you to do from this video, if there's any specific questions you have, I want you to write those down so that we can talk more about it. I look forward to getting to know you more, to understand more about your condition and about how this affects your life, and then really helping to get you the right information and to figure out what's best for you. The reality, as I talked about with the informed consent, every patient's different, and so your goals might not be the same as another patient. So we want to figure out what your goals are, what your expectations are, and then we can help to determine what is the best direction, the best path for you, and ultimately the best treatment option for you to help you attain those goals. So I'm excited to get to meet you all in person and answer any more questions you have, and welcome to ScoliosisKC.